the original strains of COVID if the public health measures are not strictly followed. So, or we loosen the public health measures or ease in it. So that's why we should remain vigilant. I know vaccination is really, really good news. We're so glad to have now 3 vaccines approved. But again, we're moving this steps together, and hopefully one day we're going to celebrate ending of that pandemic. Next, please. In this slide, there are, as I mentioned, 3 vaccines that have been approved. Pfizer is named as an mRNA vaccine, and also Moderna is an mRNA vaccine where, you know, this mRNA part of the virus would trigger an immune response similar to the ones with infection, but without infection. And this would help to create an immune response and then tackle the virus itself once we're exposed to infection. So that's one mechanism. The other is the AstraZeneca vaccine, which is a bit different. It's called a viral vector-based vaccine, which uses kind of a harmless virus as a delivery system, like an adenovirus. An adenovirus is common to cause a common cold. There are different types of adenovirus that have been used as delivery system for other vector-based vaccine as well. This was used actually for decades. So basically, when a person is giving the vaccine, the vector virus contained within the vaccine produces the COVID-19 spike protein, and this protein is found on the surface of the virus of the COVID-19. This protein does not make you sick, but it does its job and goes away. So through this process, there is strong immune response against the spike protein without exposing you to that virus that causes the COVID-19. So that's a different mechanism of action then. In terms of the efficacy, Pfizer mRNA vaccine has shown to have 95% efficacy compared to 94.1% efficacy for Moderna. AstraZeneca shows in some studies efficacy by 62%. In other studies, and studies are ongoing with the AstraZeneca efficacy, some studies also reported efficacy up to 90% after the 2 doses. Next, please. In terms of the difference with the cold chain requirement, and what we mean with cold chain is, you know, all the conditions and circumstances that are needed for safe storage and transportation of vaccine until it's being delivered into arms. So Pfizer vaccine needs an ultra frozen storage. That being said, it's -60 to -80. Pretty harsh temperature needed. Lots of logistical requirements here in terms of making sure and insurance that the vaccine is being safe and the cold chain is being safe. The Moderna vaccine needs a frozen storage with -15 up to -25. One of the facts that AstraZeneca vaccine have some advantages from a logistical perspective, despite of the lower efficacy from a study perspective in terms of the efficacy, is that it requires refrigerated conditions. So it could be stored and transported within 2 to 8 degrees Celsius. And this might have good implications for shipment and storages and transportation. This could also contribute to lower costs of vaccine delivery, given the fact that it does not need the ultra frozen or the frozen storage compared to the Pfizer and Moderna vaccine. Next, please. In terms of the vaccine rollout and distribution, I'll share with you a link to take a look at for Alberta Health's phases of vaccine. This would give more details. I'd encourage you to take a look at that. Sorry, I think it went to Regan. Regan, would you mind please sharing it with the group? So that link is Alberta Health's website showing the phases of vaccine. So basically there's an early phase in December. This is being followed by a first phase in January up to March, where 11% of the population is expected to get immunized. This constitutes the highest risk for severe illness and death, such as the residents of long-term care facilities and supportive living, as well as individuals who are critical to providing care to this sector among Albertans. In terms of phase 2, this is expected within the time range from April to September. And this continues to target the populations at high risk of severe outcome and those who might be transmitting this to these populations. Hopefully by the fall of 2021, 31% or more of the population anticipation of rollout to the general public, and by then hopefully things would get clearer and clearer in terms of the public health measures and expectation with that. We have to stay vigilant till that point, until we get further direction from Alberta Health on what the province would be planning to do. Next step. Thank you. So, as I mentioned, if you could take a look at the link that I just sent. Thanks, Regan, for sending it to the whole group. So, if you're eligible for vaccination, please make sure that you sign up online or book an appointment through 811 health link. And then you need to show up to your appointment and then to follow up to the next dose. So this is from Alberta Health's website. There are a couple of resources here. Regan and Joanne, if you could kindly share it with the group. These two links show how you would be able to, book your vaccination, sign up, and all the instructions on how to access a vaccine and book your appointment, and all the details around your appointment and how to follow up further. Next, please. As I mentioned, all the vaccines that are approved so far requires 2 doses. The second dose could be given within 42 days of the first dose. Typically, the residents of long-term care facilities would receive the second dose within 3 to 4 weeks between the first and second dose. Basically, after about 14 days after the first dose, about 92% of people are protected for several weeks, and second dose is needed to prolong this duration of protection. As we outlined earlier, personal protective equipment is still required from a healthcare provider perspective. And also, I would like to highlight the fact that vaccines are safe. From a Health Canada perspective and from Alberta Health's perspective, and in Alberta, we make sure that we would report the adverse events following immunization. We're monitoring this closely, making sure that the reporting mechanisms is being followed. Alberta has a mechanism that healthcare providers would report any of the adverse event following immunization to pertinent AHS teams. And we have also another mechanism for reporting to Alberta Health for surveillance purposes and to make sure this is being monitored carefully. I would like to assure that vaccine is safe, and basically all what has been reported is aligning with other vaccine programs, pneumococcal vaccine program as well. So basically the program is being successful, very minimal side effects of very, very mild side effects is if happens, that include like a pain at injection sites, and it's very, very mild. That's what we have been reporting, and as I confirm that it aligns with other vaccine programs as well. Next, please. So here we have a couple of questions that might come in mind, and we might think about it. And Samantha, please feel free to chime in. So is it safe? Yes, as I just outlined, it is safe, very minimal side effect encountered. Adverse event is being monitored very closely and vigilantly by AHS and Alberta Health. We have a strict mechanism to follow with respect to AFI or adverse event following immunization. In terms of severe side effects, they are very rare and it can include like anaphylaxis, for example, but we have again mechanisms to kind of monitor this once happened. Once you're eligible for vaccination and book your appointment, you're going to receive some instructions around staying at the clinic for 15 minutes at least, to make sure that the response to vaccine is being monitored. At the same time, if you have any allergies to any of the vaccine components, should this be reviewed by your healthcare providers prior to your appointment. So I'd always encourage visiting or having a conversation with your family physician around the allergies and potential effects. Generally speaking, the benefits of the vaccine way outweighs any potential side effects, unless in certain circumstances where it would be followed on a case-by-case basis by the primary care provider, and always consulting the medical officers of health. So we get consultations from our communicable disease team, who works closely with primary care providers and other physicians with respect to this certain instances. Samantha, do you have anything to add in terms of safety and side effects?
No, I guess the only other thing is usually people just get the sore arm first, and it usually is quite sore for the first couple of days. When they get their second dose, some people feel like they get a little bit more other symptoms, like signs of fever or chills, and they kind of get a little bit, they feel a little bit more sore overall. And what we would recommend is that usually if you only have the sore arm after you get your vaccine, you can go and still do about whatever you need to do. But if you start developing those other symptoms, like your whole body is feeling a little sick, or if you get a fever or something, then we just recommend that you stay home until those symptoms disappear. And usually they go away within 1 to 2 days. And so if you do get those symptoms, but a lot of people don't end up having any symptoms, and they just get the sore arm, and it's quite sore. It's almost as if you did your exercises for your arms and that's all you did all day. So
thank you so much. Thanks so much. Sorry, can you get back to the same slide? Yeah. Can I get vaccinated if I had COVID-19? Samantha, do you want to comment on that?
Yeah, sure. So you can get vaccinated if you've already had COVID-19. The main recommendation we would say is that if you're still sick with COVID-19 or you're still having symptoms of COVID-19, we just ask that you don't go and get a vaccine at that time, because you're still required to be isolating at home. So you shouldn't be going out and getting a vaccine at that time. But once you're recovered and you're feeling fine, you're able to book an appointment for a COVID vaccine. Now, the reason for this, some people may ask, well, why do we do this? I think I've already had it, so why would I try to protect myself against it? One thing we don't know is whether or not, if you've had COVID-19 already, if you would be protected from getting it again. So that's why we are saying that you should try to take the vaccination so you can protect yourself from getting it again. And so that's what we would recommend. You can get it, just wait until the right time.
Thank you. So can I get vaccinated if I have allergies? I think I highlighted this earlier. I'd encourage to work with your primary care provider in determination of the allergies compared to the ingredients. And this answers the question, what are the ingredients? I'm sharing a link with everyone. This is a Health Canada website. It has all the information that you might need from a vaccine, COVID-19 vaccine perspective. What are the ingredients, what are the possible side effects, vaccine safety, etc. So I'd encourage you to take a look at this for further information. The other question, do I still need to wear a mask? Yes, please, as we outlined earlier. You still need to wear a mask, and you still need to follow the public health measures in terms of hand washing, physical distancing, wearing a mask, until we reach a level where we get appropriate herd immunity to allow for limitation of transmission, and we get further direction from Alberta Health around the next steps. The last question here that we might have encountered is in case of pregnancy and breastfeeding. So basically, we don't have enough evidence around, COVID-19 vaccine and pregnancy and breastfeeding. And when we don't have enough evidence, we basically have a principle in public health called the precautionary principle. So we do pursue a precautionary approach until further evidence evolves. What I encourage you to do is, if indicated that you might need to have COVID-19 vaccine during pregnancy or breastfeeding, do you need to have that, or you have to have that, then I'd encourage a conversation with your family physician or primary care provider, where you get into knowing the indication for a vaccination. Primary care provider would do a risk assessment process and understanding the benefits and risks, and with yourself will be able to take an informed decision. And of course, our communicable disease team and our team from the medical officer of health office are always happy to receive consultations from our colleagues across the zone to determine the best, clinical approach on a case-by-case basis in a comprehensive way. Next, please.
Okay, so while vaccines offer really great hope for us in the future, and we can see that light at the end of the tunnel for COVID-19, we're not quite out of that tunnel yet. So these have been and will remain quite difficult times for everyone in our province and also around the world. Nobody is to blame, and it is more important than ever right now to make sure that you are kind and supportive of one another. So we must still follow all of the public health guidance to support each other every day until this worldwide issue is no longer a threat. Next slide. So I know many people have expressed some concerns about the impact of COVID-19 on their mental health. And I want to take a moment to remind you of the resources that Alberta Health Services has available to help you and also those around you and that those you care about. So we can all be impacted by a variety of different things, whether or not those are financial pressures, unexpected difficulties, unemployment, or really stressful situations such as the current pandemic and all of the other repercussions that come from that. So there are supports that are available from Alberta Health Services. There are some from addictions and mental health, although some of those types of services might have changed. So rather than going in person, you might be doing more virtual type of care. And so remember, if you're struggling, you're not alone. There are supports here that are in place to help you. And we hope that you'll take a screenshot of this or take some pictures of the different phone lines and the numbers so you can get connected here. Next slide.
Thank you. So at the end of the presentation, I would like to highlight some of the takeaway message. Please stay home, especially if you're feeling unwell. Stay safe and make sure that you protect yourself and others around you. Wash your hands, wear a mask. Please follow all the mandatory public health measures. As Samantha mentioned, be kind to one another. It's a challenging time for every one of us, so we need to support each other. Once you're becoming eligible for vaccination, please book an immunization appointment as we highlighted in our presentation. And thank you.
Thank you very much, both of you. That was excellent. And we have put a few additional resources up on the screen here. And we are also going to talk later about sharing that with you afterwards. We want to make sure that you are very that you get your information from reputable sources. So the content that we provide at AHS is continually updated, and so you can trust it. And that's really important right now because there is a lot of misinformation out there. So if you go to a trusted source, that is always the best thing. Now we're going to open up the floor for questions, but before we do, a few came into the chat box, so I'm going to back up here and ask a few. One is around the variants, and if you can please talk about that a little more. The person says that we've had almost 30 new cases every day, and there's some concern there. Why do we have this much every day? How do we protect better? How bad is it? Can it spread easily? That's a lot of questions, but I think you get the point. I think they want to know a little more about that, the variants.
That sounds good. I can first share a link, and I'd encourage you to take a look at that. So this is Alberta Health's website that shows the number of variant cases. And if you take a look at that page as well, you're going to be able to have more information about the variant. So as we mentioned, variants are, a mutated form of the virus. So viruses do mutate as they or change their genetic, structure as they being transmitted from one individual to another, and that's an expected process that happens not only for COVID but for other viruses as well. So as the virus is transmitted from one person to another, they do have this mutations. The current evidence that we have from variants of concern for COVID is that they are about 50% more transmissible if the public health measures are not practically followed. That's why we emphasize the need to, follow our public health guidance and make sure that the takeaway messages that we highlighted in the presentation, we would encourage that this is being followed to make sure that we don't give a chance to the virus once this is being loosened, So we don't have evidence to say that variants would cause a severe disease at this point in time. So all what we know, it's more transmissible, but we don't have enough evidence to indicate that it's causing more severe disease. And if you want to follow the updates, as I mentioned, this is a link for the website for Alberta Health, gives information about highlighting the variants as well as the updates for number of variant cases every day. Samantha, do you want to say anything? Okay.
Sorry, go ahead, Joanne.
No, go ahead. Over to you.
I just wanted to ask you, could you repeat some of those questions? Because there were quite a few in there.
Yes, there were. Okay. How does that happen? How do we protect ourselves? You talked about that. How bad is it? And can it spread easily inside or out? Can it spread easily inside or outside? Information about that?
Sure.
Yeah, go ahead, Samantha, please.
That's okay. You can go ahead.
No, please. Yeah.
Okay, so as we mentioned, the same measures that we used before are still good to protect you from the variant cases as well. In some cases, what we find is people let down their guard and they maybe don't wash their hands as frequently, or they might have accidentally touched their face while they're changing their masks. So I think it just makes it more easy for it to spread between people if people are not as careful with some of the measures. But if you take those measures and you're isolating properly, that's a really important thing. The other thing is, for all of the variant cases, we actually we actually call each of these individuals and do a very thorough assessment about, where did you get this from? And also we ask them all the different questions about where did you go, and do all of the contact tracing, see who they might have come into contact with. And we're actually a little bit more stringent around isolation. And we just want to make sure that they and their household do not leave their household.
Thank you. Anything else to add, Dr. Zachary?
No, thank you.
Okay. Now, there was a question around herd immunity. Now, what determines herd immunity?
That's a good question. So what determines herd immunity? So herd immunity is defined as the immunity by which at certain point where the virus is, there is limited transmission of the virus in our community. So until we reach this level, this has different factors. So the level of immunity among the community and the R node for the virus itself within the specific community. And all these factors are currently variable. So at this point in time, we cannot predict what is the level of herd immunity required to, have a sufficient immunity in order to, say, okay, we're back to normal. So it's at this point in time, it's hard to tell, but there's, ongoing work all over the world to be able to determine this point. At this point in time, what we encourage is please follow the public health measures. Please, if you're eligible for vaccination at each stage, we'd encourage that you get vaccinated, because vaccination is one of the strongest measures to tackle this pandemic. Until we reach this level and we know more down the road, what is this level, and we reach this level to be able to get back to normal life again. Samantha, would like to add anything?
Yeah, I guess out of experience, I just wanted to share that I'm also trained in family medicine, and a lot of my colleagues, I remember seeing them post about getting their first vaccine when they're still working in long-term care facilities and everything, and how momentous an occasion it was for them when they were finally able to get the vaccine. And so when the time comes for you to be able to book your appointment, I hope that you will also take that as, one of those steps for saying, wow, we're so lucky that we get to get this vaccine and you don't have to pay for it and all of these things. So it's actually a really big step. And so we're really hoping that when the vaccine becomes available for you, that you will take that opportunity to book an appointment and get yourself the vaccine as well. And if you need any help with it, then make sure you ask your family or your friends to help book you in.
Very good, thank you. A question about high blood pressure and diabetes, and whether or not one can get vaccinated with that issues.
That's good. Samantha, do you wanna comment on that from a family medicine perspective?
Absolutely. Yeah, no, from a family medicine perspective, if you have high blood pressure or hypertension, or if you have diabetes, you're actually in that risk group that is a little bit higher risk for severe outcomes from COVID. So we definitely recommend that you get a vaccine. It'll actually be very good for you. So I would highly recommend that. If you're ever not so sure about like your specific situation, now some people have like immunocompromised conditions, or they might be pregnant, as Dr. Zachary had mentioned, and you want to talk a little bit more about the details around your specific case, you're always welcome to go and talk to your family physicians. And we share some frequently asked questions with our family physician colleagues, so they can also be up to date about vaccines and can give you the right advice that's tailored to you.
Thank you. I'm going to pause for a moment and encourage our guests who, if you have any trouble understanding any of the answers, that we have people here that can help translate. All you'd need to do is put a note. You can private message Vivi if you like, or Dr. Sun, and we can have them repeat the answer for you. So please reach out and do that. A quick question around the symptoms after vaccination. If you have a fever, can you take Tylenol?
So basically, it depends on each clinical case. Like, I would encourage that this would be also discussed with your family physician, because it depends on how you tolerate Tylenol versus Advil. Do you have any other medical conditions that might not work with either of these, over-the-counter medications? So I'd encourage always to work with your family practitioner in terms of understanding which antipyretic or painkiller being used to alleviate the symptoms of side effects from vaccination. Samantha, do you want to add anything?
Yeah, I would say just usually both of those options are fairly safe. I would just say that Tylenol tends to be a little bit better in terms of its overall safety. Sometimes Advil can have some other side effects if you have other issues. So I would just kind of maybe add that from a family medicine perspective. But really, if you wanted to just talk to your family doctor about it, which one would be better for you, that's always recommended. If you have any questions, they're there to help you.
Thank you. And do either of you have any intel on the Johnson & Johnson vaccine and whether it's in Canada or being developed?
So the file is under review at this point in time. So Health Canada is reviewing Johnson & Johnson vaccine. We're looking forward to hear more, updates from Health Canada perspective once this process of review unfolds. Johnson & Johnson vaccine has, what we hear so far, it is required 1 dose instead of 2 doses. So it might have some logistical implications in terms of delivery of more vaccination. However, it's still under review. We're waiting for further information with that respect. We're glad and we're really happy to have 3 vaccines being approved by Health Canada, and we do trust Health Canada review from a scientific perspective. These reviews are being thorough. These reviews are taking into consideration vaccine safety, vaccine effectiveness, and it comes into different or several stages. So I just want to highlight also how this process of vaccine development and approval in Canada occur. And if you take a look at Health Canada website, this is being displayed very obviously. I can share the link as well if you want to have more information about how vaccines is being delivered. Anyways, I down the road, maybe Joanne, I can provide this after the presentation.
Yes, we will be following up with the group.
But basically, for vaccine development, scientists develop a potential vaccine and then conduct a lab and animal studies before testing on humans. And then afterwards, this is called what is called the preclinical stage. And then this is being followed by what we call clinical trials, and clinical trials has like 3 phases on its own, where the phase 1 deals with like around tens of volunteers to ensure vaccine safety and what is the safe dose and if there are any side effects encountered. And then the phase 2 would deal with, I'd say, hundreds of volunteers to see how well does a vaccine work and is it safe for a larger number of people and what is the safest and most effective dose. So kind of we're narrowing down, what is the safe dose and what is the ultimate effectiveness of vaccine. And this is being followed by phase 3, which includes thousands of volunteers and to test, does the vaccine really prevent the disease? And to how extent is a vaccine preventing disease? And then what are the potential side effects as well at a larger scale? And then the manufacturer afterwards submit the application for Health Canada to review. And this review, there is teams of health experts being conducted to conduct this reviews thoroughly and independently to make sure that Health Canada would approve a vaccine that is safe and that is effective and that all the benefits outweigh the risks with respect to vaccine safety. And then this is being followed by the distribution and vaccination as well. So this is how vaccine being developed and how vaccine being approved. It's a thorough process. It's a lengthy process. It's a very it's conducted in a way that endorses expertise and safety.
Thank you. We had a couple questions that were discussed a little earlier, but I think, you did answer them, but I think we need to perhaps reiterate that if you get your vaccine and you have symptoms after, you should visit your family physician. Is that's fair? That I think I heard you say that. We did, Vivi, are there any questions that you want to translate the answers for, or are you and David or Dr. Sun okay with the way it's going with in the chat box?
David is actually translating those Chinese questions into English in the chat box right now.
Oh, okay.
And I don't know. I assume if they ask in Chinese, maybe they wanted to hear Chinese answers, or I'm not sure if that's okay with them.
So can you ask the group if they have a question, they can unmute themselves and ask the question in Chinese, and then, or should we just?
They already typed it out in the chat box in Chinese right now. Yeah.
Okay. So long as everybody is getting, we have a question. Go ahead.
Hi there, my name is Julia. I have a question for my father here. He maybe somebody can speak in Mandarin. He has question and concern about for laryngectomy. It's like the cancer survival. Is it safe to have the vaccine, or is there anything to look for? Thank you.
Thank you. Generally, vaccines are safe, as I mentioned. However, if you have any medical condition that you might think that needs further discussion, please, I'd encourage you to have a conversation with your family physician. And then, as I also mentioned, that we're more than happy to receive consultations from our family physician colleagues around vaccine eligibility and vaccine, any medical condition that we might think it would be a contraindication to be able to work on a risk assessment process. And this is being done on a case-by-case basis. So there are some general contraindications for vaccination. However, with a case-by-case basis assessment is being always encouraged. Working with the family physician and with the medical officer of health, I think we're more than happy to have this assessment worked on to come up with a decision that is beneficial for the patient once we get this consultation. Samantha, do you want to add anything from a family medicine perspective?
Yeah, I would also just say, like, if you have complex medical conditions that require beyond just a family physician, like sometimes you see a specialist because of it. Some specialists can also talk to you about whether or not you should go for a vaccine and just talk about your specific treatment. So say for in your particular case, if your brother wanted to talk to his oncologist or whoever is taking care of his cancer health, that's also a very good idea to ask them about what their thoughts are about their specific case. I also do want to give a chance to Vivi and David to do any sort of translations that they think might.
Okay. Samantha, I think your connectivity is giving you some problems, I think. Now, Dr. Zachary, do you can you take a minute and address Dr. Sun's challenge as he puts it on the public health messaging around the distinction between aerosol droplets, aerosol and droplets, or aerosol droplets? That there's maybe a false sense of security with the idea of droplets being avoidable if you are this 2 to 3 meter distance. Do you?
Yeah, well, I'd like to distinguish between like the droplet. So droplet that occurs with fairly larger particles that comes out during like speaking, singing, coughing, sneezing. So even just talking can generate droplets. So that's why we would encourage the 2 meter, or the recommendation is 2 meter distance. So allows this droplet to settle down, because these droplets are kind of more like larger particles that settle down with gravity and it doesn't suspend in the air. So a 2 meter distance, evidence shows that it's sufficient for these particles to settle down. If we're using the mask, so if I am wearing my mask, I'm protecting you. And if you wear your mask, you're protecting me. So this kind of mutual protection is important as well. And this reduces the risk of further transmission. So physical distance plus the masking. That's why we always say that it's a comprehensive bundle of public health interventions that needs to be worked and needs to be implemented and needs to be followed. In terms of aerosol deals with procedures that generates aerosol. Like if you go to the dentist, for example, and other medical procedures that might generate aerosols, this might require special types of masks, like the N95 mask, for example, to reduce further transmission. The other component that I would like to highlight is the airborne mechanism, which is smaller particles that are suspended in the air for a certain period of time. This basically COVID is being transmitted through the droplets. So that's why we're encouraging, or we're requiring, the 2 meter distance and the mask. But some diseases like measles, for example, they are like airborne transmitted. That being said, they are just suspended in the air, and this lighter particles might be there. Like measles, for example, can be suspended and can be present in a room for like a couple of hours after someone has left the room. So it's more contagious.
Thank you. I've asked Vivi to translate your takeaway message from the presentation, Dr. Zachary, because I think it's really important, and we want to make sure that everybody is very clear about that. So Vivi, are you available to just check your message there? And I put the content in there. If you would be able to translate that would be appreciated.
Can I put in a question? I don't know.
Yes, go ahead. And I'm so sorry, I could cut out.
Yeah.
Okay. Samantha, we'll get back to you as soon as Vivi's done. Is that okay? I missed your question there.
Oh, OK， 那么Zachary 医生说的最主要的这几点是大家需要注意的是，stay home, stay safe， 就是能够在家里面就在家里面，在家里面是最安全，是比较安全的。那么要洗手，要戴口罩，然后要遵守所有公共卫生的这些个规定和措施。然后呢 ，be kind， 就是说大家要互相的体谅啊，要互相的，就是说有耐心呐， 对大家好，大家对大家好一些。然后呢，还有叫说你一旦可以打疫苗的时候，就马上就要去，就最快去定一个打疫苗的一个appointment，sorry，预约一下打疫苗的，就是说马上就要去定一下，一旦你一定可以的话，谢谢。OK。
Thank you very much. I believe we have gone through all of the chat box questions. There may be questions from the participants that might they may want to ask by taking themselves off mute. Anyone?
Hello.
Hello, Amelia. Yes, go ahead.
Yeah, I want to ask a question regarding to the AstraZeneca vaccine, because I just got the message from the group and mail and CBC, I think, saying that that vaccine is not recommended to the people over age 65, because I am in this group of the people. So I just want to ask whether it is true, or does Canada's AstraZeneca vaccine is not giving to the old people, or only giving to the young people? I don't know whether this this message is correct or not. I'm sorry that if I miss I missed the message from when you guys are talking about the vaccine. I don't know whether I missed that step. So
That's okay.
Yeah, I just want to make sure that. Thank you.
And
Thank
we
you.
want to make sure you you have all the answers that you need to. So thank you for asking that.
So that's a very good question. Part of this information is coming from the fact that the AstraZeneca vaccine has not been tested for individuals more than who are 65 years old and plus. However, I would say real world data would show it is effective and safe. That's what we have. That's why there are some conversations around would it be used or not. Basically, what we're 100% sure of is the Pfizer and Moderna vaccine is being used for 65-year-old and older category groups. However, as I mentioned, AstraZeneca has not been tested on as a clinical trial for older adults, 65 years and more, but rather have been tested from an age group between 18 and 65. However, as I mentioned, we're waiting for more evidence around the use of that vaccine. From AHS perspective, and from also I would assure you that we're following the current evidence and making sure that if you're eligible for certain vaccine, you're going to be able to receive that vaccine once more information is available. But generally, as I mentioned, what we heard is that real world data would show some like effectiveness and safety on 65 years and older, but the concrete solid data is Moderna and Pfizer are recommended for 65 years old plus, and the AstraZeneca vaccine have been having this clinical trials to be tested for administration for 18 to 65. However, further data around more than 65 years and older would come across. Samantha, do you have any other comments to add?
Yeah, and that's a great question, Amelia. I think you actually, that is correct in terms of AstraZeneca was tested only in those, when they were studying the participants who got the vaccine with them, they only studied those who are between 18 and 65 years old. So it's really hard for Health Canada to be able to say, yes, it's good for even people who are 65 years and older. So maybe what happens will be when you try to sign up for your vaccine appointment, they would be only giving you the eligible type of vaccine that you belong to. So say you're over the age of 65, at this time, they will not be recommending, or they will not be giving you the AstraZeneca vaccine, because that's not what you're eligible for. So you wouldn't have to worry about picking and choosing. Like, you will, based on what the guidelines are, they will offer you the correct one for you. Now, you may have heard that a lot of healthcare providers, so those who work in the long-term care facilities, or physicians and nurses that work in Alberta Health Services on the front lines, they would have received the Pfizer vaccine, and it was mostly because of the way that it was stored. It's because it was requiring ultra cold freezing, and so they needed to keep it in a place that they could centrally give that one out. And then for a lot of the long-term cares, most of those actually use the Moderna vaccine, because those are a little bit easier to transport in those refrigerators to go to the different sites. Now, with regards to AstraZeneca, I'm not sure how they were going to plan to give that out, but if you don't fall within the category.
We lost Samantha again. Oh. Let's continue.
Sure.
Well, yeah. Do you?
Sure. Joanne, I think there is another question around.
There were a couple I skipped over in. Oh, I'm sorry, Samantha. Your connectivity is very poor right now. Do you want to maybe take your camera off? Sometimes that helps. So we do have some questions that we inadvertently skipped over. So while we wait for Samantha to get back on her technology, we did have a question about whether we should be taking extra precautions if we go out to the mountains to ski and stay in a hotel. Should we be taking extra precautions to do that?
That's a good question. So the current guidance, that's why we are encouraged to follow the current provincial guidance with respect to non-essential travel. So generally, non-essential travel is not encouraged from an Alberta Health perspective. And please make sure that get updated information from Alberta Health's website and Chief Medical Officers of Health media updates. Generally, non-essential travel is not generally encouraged, as I mentioned. However, following the public health guidance would be required. Wearing a mask, social distancing, staying home whenever sick, not going anywhere, but rather, checking with 811 or online for testing, making sure for also hand hygiene, like all the public health measures would be followed. And generally, non-essential travel, as per the provincial guidance, is not encouraged at this point in time until we get further guidance.
Thank you. And Vivian, you had a few questions to translate.
I got a couple questions in Chinese, and one of them is that, is the vaccine safe for people with liver problems?
So generally speaking, we would encourage that with specifics. And I always mention this because, there are some general statements about that vaccines are safe. Anyone with chronic disease or at risk of developing chronic disease would be eligible for vaccine, because this, protects for having from COVID and its, outcomes, especially if someone is having chronic disease. However, with respect to case-by-case clinical condition, I'd encourage always to have a conversation with the family physician before going ahead and having vaccination. Vaccines are safe. Vaccines are recommended for anyone generally with chronic diseases to prevent COVID infection and the serious outcomes accompanied by chronic disease. However, I want to highlight this message. Check with your practitioner, check with a specialist, and our colleagues, physicians, whether family physicians or specialists, they do give us a call for clinical consultation. We also have a team of experts from a communicable disease perspective who works with our medical officer of health team to answer these questions on a case-by-case basis with our colleagues. So it's a medical consultation kind of approach, and we would encourage a medical consultation approach. There are general statements around vaccines and contraindications. This could be found in Alberta immunization policy. I can definitely share that. If that is not really available, I can definitely provide you with a vaccine data around the 3 vaccinations. And I think the link I shared with Health Canada could provide some information, but for further details, I could also provide this links down the road. And Joanne, please feel free to share this with the group around the Pfizer and Moderna, product, safety and all the specific information around the product. I could definitely share that. However, always it's a case-by-case consultation. So this is how we do clinical work from a public health perspective.
That's a quite long answer. Okay, I would just translate the general points there. 总的来说呢，疫苗是安全的，特别是有基础病的病人呢，我们是特别推荐有基础病的病人去打这个疫苗的。但是呢，每一个人的例子都不一样，每一个 case 都不一样。那么就说，如果不管你是有肝病或其他的基础病呢，如果你要想放心的话，我们希望你还是要跟你自己的家庭医生去谈一谈这个问题，因为对别人合适的，对你不一定合适。Okay, I'm done.
Thank you. We did have some questions around whether or not we know if the effectiveness of the vaccine is permanent, and I believe you mentioned that we do not know yet if the vaccine will be permanent, but I'll let you say that.
Sure. So first of all, I'm sharing the link around the Alberta immunization policy. This link pertains to the Pfizer, and then the other one I will share is the Moderna vaccine. And once we get further information around the AstraZeneca, we'll be happy to share it with the rest of the group. But this is what we have on the website. Please check this thoroughly. You're going to find all the information around indication and contraindication. However, please do have a conversation with your physician, and we would encourage our colleagues to consult with us as well from a medical officer of health perspective. I'll go for the next question. Sorry, Juan. So in terms of are the vaccine permanently effective or do you need annual boosters? The short answer is we don't know yet. What we know is they are effective at this point in time. Should we need annual boosters? This would come down the road. This pandemic is new to every one of us, and we're learning a lot through this pandemic. So once we hear more information, this information is going to be shared with Albertans through Alberta Health website, as well as through the media releases from our Chief Medical Officer of Health.
Thank you. We have a question from Susan Eng, has her hand up.
Yes. I don't know. Am I on mute? Can you hear me?
You can go ahead. Yes, go ahead.
Yes, I'm just wondering if there's a waiting time required before or after surgery for the vaccine?
Well, we haven't heard about surgery, but generally, I'm not aware of any, specific timeline for surgery. But again, it depends on what is the surgery, what are the implications of the surgery, what is the clinical status of the surgery. So it's so hard to tell. And again, I'm emphasizing the fact that that's why we do clinical consultations. So it's so hard to generalize. I'm sorry. The thing is, there are some general statements that could be shared, but it depends on various factors. What is the surgery? What is the clinical status after surgery? Is there any potential contraindications after surgery with respect to the clinical status of the individual? Is there any, are they on any anticoagulation therapy, for example? Because, there are some precautions if you have, if you are on any anticoagulation therapy or any bleeding disorder. There are some also potential, precautions for if you have like fevers or acute kind of fever or you're not feeling well. Again, the short answer is it's done on a case-by-case basis. I'm so sorry to say it that way, but I wished I would have been more helpful and provide more explicit information, but this is the guidance that we have. And this is a practice that we do in clinical consultation. Work with your surgeon and encourage, we would encourage also our colleagues from surgery, and we received consultations from specialists like surgeons and oncologists around vaccination, and we were able to provide clinical advice. But we need to have thorough history about the patient's clinical history, about what the surgery entails, and lots of details we ask in our clinical conversation. So I apologize for not being able to provide one definitive short answer, but the short answer would be, please chat with your specialist and encourage your specialist to work with us.
I appreciate that. And the reason I asked the question is because, I understand that it's case by case. And the reason I had to ask that question is the senior person that I know, she desperately needs to have a tumor removed from her spinal cord. And at the same time, she also desperately wanted the vaccination. So she already had taken the first shot on Wednesday. When it first, but then she has another shot in April. And her surgery is scheduled for the 17th of this month. So, and I urge her to ask the doctor, but I think she tried to avoid asking, like hearing the no answer. So that's why I kind of wanted to ask for her.
So as I mentioned, surgeries might entail some of the, and hospitalizations as well. Sometimes might need to have some medications, and we want to make sure, like from a clinical perspective, for each case is being dealt in a proper way. Please encourage her to chat with her surgeon. And as I mentioned, we previously received lots of consultations from oncologists and surgeons and internists and pediatricians and family physicians. We do enjoy working with our colleagues in figuring out these cases and being able to tackle the appropriate details in these cases. We'll be more than happy to support with this.
Okay, sure. Thank you for your answer.
Thank you. Dr. Sun, did you have a question? I see your hand is up.
Hi, sorry, am I off mute? Okay.
Yes, we can hear you. Go ahead.
I just wanted to ask about the public health messaging for the vaccines, because lots of people in the media, if you look at the answers, because a lot of people are concerned that some people will be getting inferior vaccine with the 62% efficacy of the AstraZeneca vaccine. And the general answer from all the specialists is that well, it's still a very good vaccine. It's always better than the flu vaccine, and it protects against mortality. And so that's why it's good enough, so you should still get it. But I feel sometimes the answers are not as convincing for these patients who are concerned. They're kind of feeling like, oh, well, they're just trying to steal for assist to get this inferior vaccine. And like, I just wondering in terms of the messaging, because sometimes people don't realize that AstraZeneca has 62%, including for asymptomatic infections, which is not the data for the 95% for the mRNA vaccine. So if we emphasize that, wouldn't it be really helpful to convince people to get this AstraZeneca vaccine, because it's the only one that shows that there is asymptomatic prevention?
That's correct, Dr. Sun. I would agree with you. And the reason I mentioned it, it's up to 90% vaccine effective after the first half, and then the full half, second half of the dose. It prevents, so the data that we have, it prevents the spread, and it protects against severe illness as well as death, and it protects against illness and asymptomatic. So it has a layer of protection. And I would say, if we look at the 3 vaccines comprehensively, that would provide, I would say, an excellent, effective way to have our community being protected. From a Pfizer Moderna perspective, we have 90, 95 and 94, and then the range of like from 62 up to 90% is kind of excellent. And given the fact that also this vaccine logistically is advantageous, at the same time we have lower costs in terms of delivery, and might have, I would say, easier implications from a shipment and storage and distribution as well. Given also that this vaccine is being tested on age group between 18 and 65, where there is, from a risk management and risk assessment and management perspective, this category of age group might be less risky than other categories of age group. So if we combine all these factors together, we're gonna look at a great outcome.
Thank you. Thank you very much. In the interest of time, we have 4 minutes left. I know Cecilia has her hand up. I'm going to ask that, I know we have Vivi wants to say a few words to close. And so Cecilia, we're going to go to your question and then we will close. Okay, over to you.
Hi, thank you for organizing this amazing seminar. And my question is about the AstraZeneca vaccine. So I think last time I followed it, it was last December. And at that time, the phase 3 clinical trial data was out. And I think they performed it in 2 countries. And in 1 country, they actually made a mistake by giving the wrong dose. So they said they were going to do the phase 3 again. So I was wondering, in the presentation, you showed the effectiveness for the AstraZeneca vaccine was 62%. Is that the first phase 3 data, or the later one, the one they performed again?
Could you elaborate on your question, please?
I'm sorry, what did you say?
Could you elaborate on your question?
Oh, you want me to repeat?
Yes, please.
Oh, okay, sorry. I asked the last December, the phase 3 clinical trial data was out. And I think at that time they made a mistake by giving the wrong dose in the phase 3. I cannot remember whether it was in Brazil or in UK, but anyway, they made a mistake. So the company said they were going to do the phase 3 again. So I was wondering, the data you present in your slides, you said 62% effectiveness. Is that the new phase 3 data or the old one?
So basically, this data is coming from Health Canada. It was not clearly outlined in Health Canada whether this is before or after, but I would, and I don't want to put assumptions here, but I would consider that this would be the most up-to-date data, because this is what Health Canada released after approval of this review. And it showed an effectiveness of 62% in prevention, as Dr. Sun just mentioned, the symptomatic COVID-19 diseases beginning 2 weeks after the second dose. And this effective rate is based on an analysis of results from participants who have received the two dose regimen that will be used in Canada. So that's what they will be implementing at this point in time. So I believe that's the most updated data that they shared.
Okay.
Thank you very much. I know that we want to be done by 8:30. We've been it's been a great evening. We've had a lot of really good questions. I don't know that we have answered every one of them, but you do have a very good resource in Cherry Hugh and in Vivi. So I hope you can reach out to them if you have other questions, and we can try to answer those for you. I want to sincerely thank Doctors Zachary and Chuk for coming out tonight and presenting this information and spending time on the making sure that everybody's concerns were heard. I want to now turn it over to Vivi for the last words, and then we can sign off. Over to you, Vivi.
Okay. 非常感谢Dr. Zachary， 还有卓医生，还有 Joanne， 还有 Regan， 在百忙之中给我们带来这么精彩的网络研讨会。那么呢，我还是请大家没有填那个报名表的那个，可以在 chat box 里，我把 link 放在那里。填了这个表呢，还可以得到更多我们关于 ICANN Association 的活动的信息。那么呢 ，I'm gonna share a quick screen. If it is okay, so this is ICANN Association 在微信上呢是有很多群的，那么你加入其中任何一个群呢，都可以得到这些活动的信息。That's it. Thank you.
Thank you. Thank you very much. So for more information, would you like us to include that link on our follow-up information, Vivi?
Sure.
Okay, thank you. Well, everybody, it was a real pleasure to spend this evening with you. And with that, I am going to say goodbye and take care, everyone. Have a good evening and be kind to each other.
Thank you. Thank you so much.
Thank you.